Welcome to the Money Pig Podcast, presented by Goodwin Investment Advisory, where our mission is to lead you to financial pig, peace, independence, and generosity. I'm your host, Tim Goodwin. So we are super excited to have Merle Jabr, is that how we say your last name, with us here today. Super excited to have you here. We're a big fan of yours around the office because you help our clients navigate health insurance options, which is super great. You've actually helped our company with our first group plan, which was, kind of a big mountain to finally move. So we're grateful for that. Before we get started, I did want to ask you a question. Do you know why Peter Pan is always flying?
Ooh. No.
Because he never lands. See, you know what? She got it right away. I always got to throw a good dad joke out on there. So, we're not here today to talk about dad jokes. We're here to talk about Medicare options.
Correct.
So this is really a cool, I guess it's called an entitlement in kind of the vernacular of the government, where when, as an American, when we're 65 years old, we have the option to switch over to Medicare, not to be confused with Medicaid. Mm-hmm. So Medicaid would be something if you're at a lower income or a lower net worth status, and you could get access to that much earlier than age 65. And a lot of our clients that we work with are thinking about retirement. Like when I ask them, like, when are you going to retire? Mm-hmm. By default, a lot of them would say something like 65. And you're like, why are they picking 65? It's not just a nice round number. It's when they've got health insurance if they stop working. And I think what's really powerful is to also talk about options, which we'll do on a later episode. If you want to retire before age 65, what health insurance options you have beyond your employer coverage. But today I kind of wanted to talk about, let's say you're 64 or thereabouts, you're starting to learn about Medicare, you're getting close, and you want to start learning the different options. So I think that's something I want you to maybe expand on is explain who's eligible for Medicare. Is it just age 65? And then we'll maybe talk about why there's so many options. We have to film a whole separate podcast about it.
Absolutely. Yeah. Well, first and foremost, thank you for having me today.
Gosh,
I'm very excited
to have you.
Medicare, as you just mentioned, everyone thinks age 65, that's when I'm eligible. I get all those benefits that start, I'm going to retire, everything's going to be great. You actually can become eligible for Medicare earlier if you are deemed totally disabled.
Oh,
that does have to be a state-based eligibility. So It can't be that you had disability through your company and you're continued on long-term. You still have to go through the Social Security Administration and get that approval. If you are deemed totally disabled, Medicare can kick in at age 62 or even 24 months after your total disability. So you could be 50 years old.
Really?
And
24 months after.
Correct. Medicare can kick in.
Really?
So That's are benefits.
To know.
And a lot of times, as we age, different conditions come up. And for business owners or for individuals that have been with companies for years, have some more flexibility at times to make those decisions. And you'd be surprised how many things can make you eligible for total disability.
Okay. So something to look into more, the Social Security definition of disability. They've got to sign off on that.
Correct.
And then 24 months from 50 or from that. So that's great because like we were saying about Medicare, you're really only going to be eligible for that with very low income and very low assets. But if you've got a decent income, maybe you're disabled, but you can still work, or maybe you've accumulated some wealth over time, you want to have access to the health insurance. So, and that's interesting. If that disability causes you to not be able to work, you could get COBRA and pay for your health insurance for, I don't know if there's a different time frame after you're disabled.
18 to 24 months on COBRA. So.
Great. Thank you. That's awesome. That's super helpful. But after that, then you're like, what do I do?
You're stuck again.
That might be an interesting thing with the 24 months.
Absolutely.
Because COBRA might be able to carry you until that point, or at least close.
It gives you that time to prepare and apply and set into motion what you need to do.
Okay, so it's not 24 months from when the Social Security says, okay, we agree you're disabled. They're going to go back to the date of disability.
Correct.
Okay, very cool.
Yes.
Wow, I learned something new, folks. That's great. Okay, so that's Is there any other kind of interesting fact on eligibility other than 65 or disability?
Typically not.
Okay.
Typically not.
I think I'm aware of too that like if you're still working and you're age 65, you don't have to go on
That's
Medicare.
correct.
Is that true?
That is true.
Okay.
You have the option of continuing health insurance benefits if you are working and have coverage through your employer. You actually have the option of continuing individual healthcare benefits, even if you aren't working. You don't have to go on Medicare at age 65. But if you choose to, there's a whole new world that opens up.
So it's not really like automatic then. It's not like an opt out. You know, like you're 65, they're signing you up. It's still an opt-in thing.
That's correct. You still have to opt in.
Okay.
Be aware, though, that if you do not opt in, you can face penalties for not having health insurance or Medicare. So you do have to have one or the other at that point.
Got to have some coverage.
Correct.
Right? Okay. So before we go into each option of Medicare, is there a way you're like, yeah, it gets sticky. I can see that smile. Like if you take a step back and say, like, why are there different parts to Medicare?
Great question. So backing up for just a minute, if you are turning 65 and Medicare's what direction you're thinking about going in, you can enroll 90 days before or 90 days after your birthday. So if your birthday is coming up in April, come January, you can start to process the enrollment. Typically, the first step and the first option in Medicare is going to be Medicare Part A and Part B enrollment.
Okay.
What does that mean, right?
Let's go.
What does that mean? So that means Part A is considered hospitalization and skilled nursing. That's all Part A covers. So go to an emergency room, if you go to a hospital and stay, if you have to have a skilled nurse that come into your, whether it's home health or a clinic-based health, that's everything Part A covers.
Okay.
There's deductibles associated with that. There's maximums, just like health insurance. Part B is everything else, pretty much. It's your doctor's visits. It's your labs. It's your advanced imaging, diagnostic testing. So everything else with the exception of prescription, because prescription
is another part.
D for drugs. That's what I always say to remember it, is Part D. When you go to enroll in Medicare, you go through Medicare to enroll. They will enroll you in Part A, Part B, and Part D. They didn't always enroll you automatically in Part D.
Oh, okay. But now they do.
Now they do.
Like, did we missed a letter in there? We list C. So is C
great question.
Normal or?
C is different. C is not what you would automatically enroll in. C you actually enroll in after. And that is considered Medigap or Advantage, or I'm trying to think of other terms. There are so many terms, but Part C replaces Medicare. So your Medigap coverage or your Medicare Advantage, a lot of people don't understand because you get all these flyers about it in the mail. You get all these commercials about it. Sign up, Advantage. It's free. You don't have to pay anything. But what it's doing is it's replacing the coverage Medicare A, B, and D are giving you.
Interesting.
There are big differences in the details of those coverages. But again, the important thing to remember now is you cannot enroll in Part C until you can't choose an Advantage until you have done your Medicare A, B, and D enrollment.
Interesting.
You go back after the fact.
And why would you pick Part C over the normal ABD?
Great question. Typically, it is cost associated that people choose a Medicare Advantage. They are also highly marketed.
Is it cheaper then?
It is cheaper.
Oh, okay.
It can be no cost as well.
Okay.
Yes.
Okay.
So.
Okay, I got you. Because so normally when you switch to Medicare Part A, B, and D, it's not going to be free. Right. So there's going to be a premium, a monthly premium.
So Part A, there is actually no premium. You are paying as you work all these years and pay the taxes to Uncle Sam.
Yeah.
You are paying for your Medicare Part A already.
Okay.
The cost is the Part B. Part B is based on your income and they look 2 years past. So let's say, you are turning 65 and the age snuck up on you and you did really well and you made a great salary or great income 2 years ago. you would be in the highest tax bracket for your Part B for your monthly premium. You can do a look back and say, hey, that was my income 2 years ago. That's not my income now. You can do that, but that's an appeal process.
You got to ask.
Because it's going to be the last 2 years. So they're going to set that monthly premium for Part B. And then Part D has an automatic premium monthly that the state, whatever state you're in, charges.
So the Part D cost does not vary with your income?
Correct.
It's the same for everybody?
It is the same. Only your Part B does.
I'm learning stuff. This is so great. So that's right. Because I think it's like the Medicare tax is like 3% or something like that. So that's interesting. So that's covering, my Part A, my future hospital stays. Okay. So Part B is the one that varies. And I know for our clients, especially our clients, we are planning for that because there are Medicare premium surcharges, right? And based on that income. So the more income you make, you're going to be paying more and more premium surcharges on top of the normal premium. And so there is some planning to do, like you're talking about with the look back and the appeal. My income's not that high anymore. And so you've got to be concerned about that. They do charge you more if you're making higher amounts. And so there's some planning opportunities there as well. I wanted to go back though. I had a question earlier about Part A. So, is there just like specific hospitals I have to go to that are Medicare only, or can I go to any hospital?
Great question. So Medicare A, if you are not on an Advantage plan, you can typically go to any hospital. It is very rare that a hospital would not accept Medicare, pure Medicare.
So then that hospital is really only going to get Medicare's rate for allowing me to take up that room.
That's correct.
Bed. Okay. So it's not like I don't have to make up the difference because I went to some fancy hospital.
No.
Do I? Okay.
No. But Medicare Part A does have the deductible and does have a maximum, and that changes every year. Typically, it'll start at, let's say, around $5,000 to $5,500 is your deductible. So what does that mean, right? What does that mean? That means, let's say I go to the hospital and I'm there for 3 days, and I went in through the emergency room. So I had emergency room care. I went in and had testing done while I was staying there. I had all these services while I was in the hospital. I had the room I'm paying for. Medicare A is going to charge towards my deductible. And even though I'm getting a Medicare rate, if those costs are over $5,000 or $5,500 or whatever year we're in for Medicare A, I have to pay that cost.
Okay.
There are ways around it, which we'll get to, but for the purpose of this discussion right now, you have to pay that cost up to a maximum out of pocket, which typically does not go over $7,000 to $7,500. And once you meet that, you're done. Medicare pays the rest. So still, if you look at the bigger picture, let's say a with or without game, you're looking at most $7,500 or so, $7,500 out of pocket versus what could be hundreds of thousands without.
Right.
So
you're coming out of pocket first until you hit that deductible, and then Medicare is covering after that.
Correct.
So really, this is going to, if you're just in the hospital for maybe a day or two, it's probably not kicking in. But if you're in for a long stay,
that's right.
Medicare is going to kick in after that.
Medicare rates, contract rates are so low that you would need to stay for 3 to 7 days before you're going to see those rates coming out.
Interesting.
But there are ways to avoid it.
Okay.
And so we'll talk about that.
So before we do, if Part C has replaced, if I move to Part C, maybe because it's cheaper or whatever, to replace Part A, B, and D, how does that affect my hospital stays?
Great question. So if we're replacing Medicare A, B, and D, and we're going with an Advantage or a Medigap plan, we're looking at different coverage terms. Depending on the plan you are choosing and the company you are working with, 2 things happen. Now you're in a different network. You're not in Medicare's network. So that question, do every hospital take you? It depends
on your network.
It depends on your network.
Now, why would I go to that Part C if I feel like I paid into Medicare Part A my whole working career? Am I still getting any benefit there or not?
I'm sorry.
Well, like I've paid that 3% towards Medicare through my payroll. So I've been prepaying for my Part A. But if I switch to a Part C that replaces my Part A, am I just kind of foregoing that benefit? Or does that benefit somehow translate to the Part C?
The benefit translates on Part A pretty well.
Part
B is where it changes.
Okay.
And that's, again, where the cost is.
Okay.
So,
okay. All right. That makes sense. Okay, great. So do you want to maybe back into then some of these strategies to, like you were saying, that you could kind of get Part A to kick in faster?
Correct. So the option, if let's say you're still looking at your Part A coverage and your Part B, and you're saying, Medicare's paying a lot, but they're still not going to pay enough. I'm still paying a premium for this. I still have to spend $7,000 plus if I go to the hospital. I still have to spend $1,000 plus if I go to a doctor and have a test done. I don't want to see those costs. Maybe you want your costs fixed. And this kind of goes back to the planning. When you're planning to prepare for what you're going to do, you also may need to plan for what your medical needs look like, because without that planning, if as much as you can plan, right, you could be looking at big costs. So that's where supplementals come in, Medicare supplementals. They do not replace Medicare like Medigap or Advantage does. They go on top of. It's like an umbrella. Okay. I always tell my clients they pay for what Medicare does not. That's the way to think about a supplemental.
Okay. That makes sense. And so are these supplemental Medigap plans, are these like familiar to us? Is it maybe like the insurance we had with our employer, or we were self-employed and they might have an option that we could keep that coverage and add Medicare to it?
So for a lot of individuals that are getting to age 65 or older, retirement age, there are retiree benefits that companies will offer where you will be enrolled in your Medicare A, B, and then they will have options for a Medigap, a Part C plan, or supplementals. And you can keep those plans with certain employers as a retiree, even when you're not working with the company anymore. It's a benefit that you continue to have every year. Okay. Very cool. Wow. I'm learning a lot. I want to kind of keep moving on just for the sake of time, because I feel like if they got more questions, they just need to contact you directly. Right. Okay. Yeah. So, actually, before I forget, how would somebody get in touch with you if they wanted to, ask more questions and engage your services? My company is Potter Risk Advisors. Our website is www.potterrisk.com. All of our contact information is there. Someone is always available. I'd like to say Monday through Friday, 8 to 5, but that's not true. 24/7.
Yeah. We get that.
And we work in conjunction too with you all as financial planners as well in preparation for these types of scenarios. So
cool. Very cool. Yeah. That's super helpful. It's glad that we don't have to be the expert on stuff like this. And we can just be like, well, we'll call Merle.
That's right.
So, talk to me about what enrollment is and what that means. And, maybe you're self-employed, you're not even familiar with what enrollment is for insurance, or maybe you are familiar with it, but what does enrollment look like when it comes to Medicare?
Great question. So there are several different types, but enrollment is the same process, whether you are working for an employer through a retiree benefit, whether you are self-employed, or whether you are now retired and just an individual looking for options. Again, typically there is always an open enrollment period. That's normally going to be with employers once a year, depending on when they've created their plans. Okay. For retirees, for employers with retirees, for self-employed business owners, we go back to that 90-day before, 90-day after is their first enrollment period for Medicare.
Of their birthday.
And then every year, October 15th is typically when Medicare enrollment begins. Oh, okay. So everyone, once they are on Medicare, open enrollment happens every year. What does open enrollment mean? That means if you're on Medicare and you have a supplemental, or if you have an Advantage Part C / Medigap plan, you can make changes to that plan for the upcoming year.
So you may not have to do anything.
And you may decide you don't want to change.
But if you're going to make changes,
will be auto-renewed, because I get that question a lot.
Okay. Well, that's great. I know we can dive into more details. Is there anything kind of at this level that you feel like we want to touch base on?
I think I would just add that, with Medicare, we talked a lot about how Part A, you don't have a cost for. Part B, you do. I just want to kind of reinforce the idea that if you are thinking about going the Medicare route, to try to plan ahead of time with your income as much as you can, because the Part B premiums can be very expensive. It is the only part of Medicare that is really expensive, to be honest. Supplemental plans are very affordable. If you choose Advantage, obviously those can be free. Part A is free. Part D is low cost, but your Part B is based on that income. And if you are a higher income individual, you would be looking at some costs. So the more you can plan that, the better.
And when's the best time to start planning for that?
I always say if you know that in the next year or two, you're going to be eligible. If you can plan 2 years out, that's the best because it's a 2-year look back.
Oh, so 63 really?
Yeah. So really you might want to even go back 3 years because they're going to look those 2 years. So if you have to make any adjustments, it gives you a year to do it before that.
That's awesome. That's great advice. I did, was reminded about Part D a little bit, a question I had. So that's going to be covering my drug prescription.
Correct.
Is there any flexibility to increase that or decrease? Is that covering every prescription I have, even if it's like experimental or really expensive or really rare?
Great question. So there are many different types of Part D plans. You can get a basic plan as low as $14 where it only gives you your generic prescriptions. Now, let me back up for a minute because remember, Medicare now will enroll you on Part D automatically through them. Mm-hmm. After you are enrolled, though, just like a supplemental goes over your Part A and B, you can choose a Part D plan that will replace the Medicare plan, and you can have it through any healthcare insurance company available.
Oh, okay.
And they have lower cost options. They have higher cost options.
Okay.
Most, and again, it kind of depends on the plan based on the coverage you get. But let's say you get a plan comparable to what Medicare Part D covers. You're going to have the same drug formulary, the same types of medicines covered that you would on a health insurance plan. There are those times and those clients that may have very specialized medications. There are still ways to get those covered with some additional authorizations and such. That's what we help with as well. But there are a wide variety. So again, you enroll in your Medicare A, B, and D first. Afterwards, you can go do a supplemental and Advantage or a different Part D.
Part D.
Correct.
Okay. Gosh, that's great. Well, thank you so much for that. That's super helpful. For those listening, if you wanted to get in touch with Merle, definitely go to Potterrisk.com. Potterrisk.com. And then we also have this guide for you. I can kind of show you here. Navigating Medicare options before you retire. So you can go to the show notes and be able to download that. So Merle, one of the things I like to do when we finish an episode is just to share something that we're grateful for.
Okay.
So while you're thinking of something, I will share that I got to run this morning and starting to get a little bit cooler, but I'm just grateful that even though I'm getting older, that I can still make this body,
there you go.
Move into a jog and to be able to be outside is something I love. So what's something you're grateful for?
I have to be honest. I am grateful for my son.
Oh, awesome.
So I adopted my son years ago, and it was a long, strenuous process. But he is the best kid in the entire world and 6 years old now and growing every day and just the love of my life.
Oh my gosh. What's his name?
Phoenix.
Ooh, yes. I love that name.
Like
that
the Phoenix bird.
Yeah, let's go. Man, that's so cool.
Yes.
Well, I hope Phoenix is getting excited for colder weather here too. And thank you so much for joining us. We appreciate you.
Awesome.
Thank you for tuning in to the Money Pig Podcast. We hope you enjoyed today's episode. To stay updated on new episodes, be sure to subscribe wherever you listen to podcasts. If you found value in today's discussion, we'd greatly appreciate it if you could leave a rating and review. If you have any questions about the topics we covered, feel free to visit us at goodwinvestment.com and reach out. This episode is produced by evance.net. This podcast is provided for informational purposes only and should not be considered as investment advice, a solicitation to buy or sell any financial products, securities, digital assets, or other investment vehicles, nor as a basis for making any financial decisions. Goodwin Investment Advisory is a registered investment advisor with the SEC, CRD number 131193. Please note that the host and or guests may personally own securities, digital assets, or other investments mentioned in this podcast. Investments carry risk and are not guaranteed unless stated otherwise. We strongly recommend consulting with a qualified financial advisor, tax professional, insurance professional, and/or legal professional before implementing any strategies discussed in this episode. Lastly, past performance is not indicative of future results.